At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Migraines and Headaches on Wednesday, March 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome to Dr. Tom Roselle Live. Hi, guys. This is Dr. Tom, and I got a great program for you. And unfortunately, it kind of goes in contradiction to the beautiful, gorgeous sunshine day that we have outside. We're talking about your head hurts, right? We're talking about a continuation of why we have headaches and the really bad kind we call migraines and cluster headaches and things of that nature. Well, we're going to get into a little bit more detail because it really has a far-reaching implication on many other situations. And we're going to touch today a little bit on the headaches that people have been having post-COVID. And it seems to be over the top. And we'll talk a little bit about that and make sure you understand it. But understand that it's a warning often. It's a finger pointing. It's telling you that there's something not quite right. So we want to get into this chronic migraine pattern and headaches and distinguish what the difference is and so forth and so on. And I want to remind you that coming up on the 13th of this month, it's called March already, there'll be a program on migraines and headaches and all those things that make your head feel like it's going to explode. And I'm going to present with Dr. Scott Lamp. And those of you who know Scotty know that he's amazing in his presentations. He's so much information in one human being. It's really a pleasure always to be with him. You know, today's world, when you have any kind of pain, they either want to throw a drug at it, like oxycodone. You go in for any kind of surgery. I don't care if you have a tooth extraction, and they're going to put you in oxycodone. And otherwise, they're going to hit you with Botox. They're going to inject, the muscles of your body and see if that will relax it enough. The problem is, in both situations, you have tremendous side effects, and we'll cover that. And the side effects, unfortunately, often can be long-standing and could be permanent, particularly when you're dealing with Botox. If you really get into the literature, you understand that Botox, the drug Botox, they inject it, and I have creams that are made of it and so forth, is a neurotoxoid. And subsequently, it has the effect of causing some brain problems. And we'll talk about that also on the 13th. And I want you to register today after the program. Just get online and check it out. Go to rosellecare.com. That's rosellecare.com or drtomroselle.com and register. But let's get into this and let's talk a little bit more about what we can really decide about these headaches. I want to start with the COVID problem. We're in that place that everybody's going back into this fear pattern of COVID. You've seen people mask up. You're seeing people say, oh my God, don't get too close to me. Don't get so fearful, my friends. You have more antibodies in your body right now than you can possibly think of. And this new variant is mostly an upper respiratory. It causes your sinuses and your throat not to feel so good and maybe a little bit of yuck over a couple of days. But it's not something that generally across the board is going to kill you, which is a good thing. But there's an article out of PubMed. And this thing was actually published a couple of years ago in 2022, towards the last part of the year. And it was talking about the headaches that were beginning to show up, if you will, as a result of not only COVID-19, but also the vaccinations that were also causing some problems. So it went on to say that these hospital admissions for people that felt that their head was coming, unglued, they realized that they were probably benign relative to tumor formation or vascular impairment, but there was an inflammatory reaction. And they said, well, it wasn't significant. It was about, about 14% of all emergency department, emergency room admissions. That's a lot of people. And, when you think about 14% of all the people that go in, for some kind of head pain or headache or something of that nature, that's pretty top. So when they start looking at the statistics and you really start picking it apart, you know that there's a problem here. Headaches, they concluded, attributed to the use or exposure of any substance. In this case, they were talking about the vaccines during COVID, had possible characteristics of headache. And these headaches can present themselves in many different representations. One is a trigeminal vascular headache, and where that is, if you go to your jaw where you open and close your mouth, there's a nerve that comes out of there called the trigeminal nerve, and it has three divisions. That's where the name came from. One goes down to the lower part of your mouth and your jaw, the other one goes across your cheekbone, and the other one goes up over your forehead. So you can have one-sided headaches. Now, what we also know about that trigeminal nerve, that it has a propensity to house viruses. So not only do you have the virus that could live in there, which we've now seen is a very interesting place for it to live, but also, in addition, the inflammatory reaction that is triggered by these, remember, we call cytokines and other pro-inflammatory molecules that are released, following vaccinations. We know that. This is not Dr. Tom talking about. This is legitimate research of guys that really take the time and dig into this thing. And if you want to find out, this was published online first in 2022, the end of the year, November. And you go in, and there were, basically 8 authors that contributed to this thing. So the cohort studies were quite significant and finger pointing. So all of a sudden, people are coming up with these crazy headaches. And the headache, it was reported, the percentage was 25 to up to 58% of people in certain age groups were generally under the age of 55. Interesting as well. So the headache was, it seemed to be the most single neurological and the most frequent adverse effect of contracting COVID, but also, more importantly, with the vaccine, the immediate side effect. Now, we know that there are many other side effects of the vaccines, everything from cardiac problems to other neurological problems and immunological problems. The immune system starts dumping and so forth. But I want you to remember that. Now, what they also found as a result of it, these headaches may promote what's called a coagulation cascade. And that means that you're getting clumping of cells and clot formation. This was also giving rise to these headaches. So this is not something to be set aside. But what we saw was the characteristics by severe clotting and these thrombus, these little clotty formations in the body. And it could be treated with high-dose anticoagulants and these things that they call immune globulins to kind of to stabilize what was going on as a result of the vaccine. But it's a real deal situation. Fortunately, we've been able to develop a pathway to be able to identify them and being able also to treat them. So you have to understand the mechanism. Now, if you have somebody with high blood pressure, to begin with, the inflammatory reaction that was caused by all of this thing just caused it to be much worse and increased the person's pain presentation, if you will. So now you got 2 pieces of the puzzle. You have the blood pressure that's elevating, but you have this increased coagulation that's causing the irritation to the blood vessels. Now you got to be careful. You have to be able to identify, the horse and the carriage and which one's coming first to be able to really do something about it. Now, we found that low energy light laser and acupuncture and very specific natural anti-inflammatories actually work far better than some of the approaches that they would use typically in a medical setting. And it handles the body in a very much more supportive, gentle way, but it doesn't increase the capacity of the body to send a clot someplace it shouldn't go. So, for example, a patient would come into a practice like ours, and what we're seeing is a lot of indicators that would suggest there's something going on here, and it's an inflammatory reaction. But we've talked repetitively that your skull, that houses your brain, has 22 bones that make it up. And when you get this swelling, it affects the spinal fluid and it causes a aberration or a change in how the rhythm of these joint spaces of these bones begin to move. So subsequently, what happens is they lock, they jam down. And now that causes an increased pressure as well. So now you've got high blood pressure with the patient sometimes, not always, but sometimes. Now you have this inflammatory reaction and this clotting that is taking place by the vaccine and also COVID. And then in addition to that, now you've got the normal movement of the cranial plates not moving the way they're supposed to move. So they're increasing the pressure on top of that. So once you begin to understand that, how you're supposed to approach this thing? You're just going to throw a drug at it, see what happens in the morning. We'll see how you respond, or do you have to identify the actual mechanism that's there and support the body in being able to resolve the problem? So these viral patterns that come about both by the COVID-19 and also the viruses that are stimulated by the vaccines, the viral DNA, if you will, binds to these platelets in your body. That causes the clotting factor to come about. And, when you get to that place, I have a friend of mine out in Western New York who owns a funeral home. And it's a morbid subject, but I think you need to know. And I called him up and we were talking about, what are you seeing, as a result of all this craziness? Because you remember that over the news feed, you're seeing all types of indicators that, they're pulling clots out of people. And, I'm the guy that I'm going to the source. I want to find out what's really the truth and what's not the truth. So I called him up and I said, hey, man, I said, have you noticed any different things with any clots, because when you embalm a body, you're taking the blood out. And I know I'm getting pretty graphic, but you need to know. And he said, Tom, he said, in my entire career, I have never seen anything like this. And we can't, and this was the initial stages, we can't publish it. Now they are, now it's going us. But, there was these patients that were hospitalized and they actually established a red flag, finger pointing. If you see this, guess what? You have to look for that because you got a problem. And otherwise the patient's going to have a much more serious condition. So on the 13th of the month, when you join us at the Roselle Center in Fairfax, we're right off the National Capital Beltway, Route 50. Make sure that you register because if you don't, we only can sit so many people. And we want to make sure that you get the data and the information, and more importantly, the approach of how to go after this. And if you've had a problem with constant head pain, if you've had a problem, with that throbbing feeling in your head, this is an opportunity to find out really what it's all about and make sure that you have the opportunity to solve it, resolve it, and make a difference across the board. There's a lot of anti-inflammatory things that you can do to protect yourself. And we're going to talk about those things, little things that most of us have forgotten about, and we'll share those with you on the 13th and make sure that you have as much information as you can so you can help yourself. There's some really good things, but there's also some things that look like they're natural, but you need to be careful and to avoid them as well. And we're going to talk a little bit about that sort of situation and show you what headaches really are, how to distinguish, but more importantly, if it's not a migraine, if it's not something that's induced from a COVID vaccine or a COVID virus, what we do in our practice is one of the most successful ways of resolving it and taking care of the problem very effectively, very rapidly. And I think you'll be very, very surprised, how quickly certain things can be resolved. So, join us. But here's the deal. When you're looking at a problem, and particularly when you're looking at head pain of any kind, that dull, repetitive, it's always there type of thing, scale of 0 to 10, it's constantly a 4. It spikes up to a 6 occasionally, might go down as low as a 3, but it just never, ever goes away. We have to be able to identify it, and we have to know the neurological effect and be able to trace that all the way through. Where's it coming from? Is it coming from, God forbid, a aneurysmal pattern that's someplace? Those are the as you'll hear me say, the zebras that are running around, not the common situations. But you still have to make sure that you rule those guys out. Is it a result of a clotting pattern that's showing up? Could it be the beginning cases of Bell's palsy? When that you lose your facial integrity because the nerve is being irritated with a virus, or the TMJ itself is not working, so it's shifting those 22 bones that we've talked about. We're going to go over that. We're going to show you how to be able to really say, okay, it's not a clot, but I got to get something done with this because my head hurts and I don't want to have to deal with it, in an ongoing situation. I've told you many times, my story, how I ended up doing what I'm doing because my wife had migraines from the time she was 5 years old. And it was because of the Elgin Chiropractic Clinic in Elgin, Illinois, that resolved the problem after many years within a very short period of time, that I said, hey, I don't have to go anyplace else. This is how I'm going to help people the rest of my life. And I want to share what I know about these things with you. I want to show you what options that you might have to be able to resolve this. So this area is a very passionate area for me. We've had patients who were on disability because they couldn't work, they couldn't think, they couldn't focus, they couldn't function. And we're able to resolve them and put them in a position where, they got their life back, if you would. So you look at the statistics, you look at, what really is taking place in so many of these unfortunate situations, these head thrumpings, as you might call them, and understand there's a way out. Instead of taking all the medications, the oxycodone and other things, the anti-inflammatories, these depressants, because they're using so many tranquilizers now to get rid of pain patterns. Don't know why, but that seems to be the direction that, unfortunately, medicine, in my opinion, is taking. But when you have the ability to look at structural work that is very gentle and supportive and balancing in the body, you look at low energy light laser and acupuncture to take the stress off the body. When you look at homeopathic relief and being able to upregulate the body's capacity to virtually resolve anything, because the body has the ability to shift and change and heal itself. But unfortunately, we set it aside. We say, no, that can't work. That's too simple. Well, unfortunately, it's pretty straightforward for those who say it's not that easy. There's things like lavender that will help, and it's known to relax the muscles of the body. You have ginkgo biloba. Ginkgo opens up the small, little, tiny blood vessels in the brain. You have feverfew, which has been known for years to handle things of that nature. And even organic ginger root, not ginger, but ginger root. If you have an inflammatory reaction, just getting a little piece of ginger root. Go to the store, get organic ginger root, take a snip of it, and put it in your mouth and chew it up. It'll solve the upset, the nausea. And cinnamon will decrease the inflammatory reaction. You got peppermint, which does the same thing as well. So there's whole arsenal of very straightforward things that you can't get in trouble with, and that can make a difference. And we want to share those with you in addition. But if you don't know about them, you're stuck with taking drugs and making things problematically worse for yourself over a period of time. And it does, it cascades. It just builds, it gets worse. It causes other things to begin to show up. There's certain lights. Have you ever heard about a green light that resolves a lot of the problems with the body? There's an actual big study that was done at Harvard University, and it goes back to 2016. And they showed that low intensity LED green light was effective for reducing pain and the sensitivity of your eyes, if you will, with migraine headaches and other type of headaches and all kinds of things that go thump in the night. And it was very interesting. And, particularly when you understand that the headaches that we're talking about, just the migrainous type of headache, affect over 14% of the global population. That's a huge number of people, my friends. And, it gives you, distortions, including, the pain, the loss of vision, nausea, vomiting. Your quality of life goes out the window. You can't work. You can't go to school. You can't focus. And let alone all the money that it's costing indirectly and directly. You can't work. You lose money. Your employer loses money. You're going to debt because now you got to do damage control. So if there's a way out, if you really knew that there's a way to fix this, I would think that you would be really interested in. We're going to give you a lot more of that, obviously, and make sure that you have all the information that you need. During the study that we've been talking about, 60% of the people just with minor applications, 60% had complete resolution of the problem. And I don't know about the rest of you, but that's crazy good. My world, the results are usually 80, 10, and 10. 80% of the people that we see with this type of headache or any kind of headache resolves the problem. 10% of the people we get to help a lot. Another 10% we don't do very well with. Now, if you look in the traditional media, it's the other way around. In the allopathic community, it's 10, 10, and 80. And they feel good if they can modify it some way. We're looking to resolve it. We're looking to see what the cause of the problem is. And if we can do that for you, if we can resolve the problem, how much more would your life be worth and your ability to do whatever it is that you want to do in the world? Wouldn't it be great? Wouldn't it be an amazing uptick with what you do? I think so. We're coming out to the end of the program. I want you to remember that, in about a week, right? The 13th of March, I'd love to have you as my guest. I'd love to have you with me. Make sure that you bring your head clear so I can give you as much data as I want. And remember, I do this because you deserve it, but simply this, I love you all. You have a great Sunday. Go outside and go for a walk. It's a beautiful day. I'll see you on the 13th.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Migraines and Headaches on Wednesday, March 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.